Is it ever necessary to take medicine or to take a pill? The answer to that is yes. Unfortunately, it is, or maybe not unfortunately, it's just the way it is. And I think, from my experience and what I've seen, it's due to a lack of faith and understanding. I had a woman that came to us in 2001, and she had stage 4 advanced cancer all over her body, large breast mass, and this was in June of 2001. And she said, I don't want to do anything but the lifestyle you're talking about. And I said, well, she wanted to do intravenous vitamin C, nothing. I said, will you come in at least monthly and let me just examine your mass? She said, sure. This was June of 2001. She got better and better and better. She was able to move her arms. She was feeling wonderful. In January, 6 months later, she had a fatal automobile accident. And when they did an autopsy, there was no cancer. Wow. So, if you ask her, do you need a pill? The answer is no. Okay? And it's been my experience, I rarely have met someone with that level of knowledge and faith. The magic pill, we're sitting in it. It's our bodies. Our body is the magic pill. It magically heals. Do you know of anything artificial that we have produced that heals itself? How about the best computer? How about the best car? How about the best $20 billion space shuttle? It can't heal. These things heal. Okay? And what are we looking for by taking a pill? Healing. So the healing exists. We are the pill. What we need to do is just get out of the way. It's I don't know how else to say it. And he says, unless you take this magical pill, it's going to save your life. Because you are lacking in this drug. It's a crazy, backwards system that just doesn't work. I'll tell you how you know it doesn't work. If doctors knew what they were doing, the hospitals would be empty. Instead, there's waiting room only, standing room only. They're full, and they're getting fuller. I see pharmaceuticals really as being, for example, you come in with high blood pressure. Let's say your blood pressure is 240 over 120. That's pretty serious. Okay, we can give you a drug like they do in the emergency room, or we can just give you an IV of magnesium. Magnesium will lower immediately, without any harm. We're lacking in magnesium. So in most cases, except trauma and surgery and things like that, there is a natural way to deal with it. Even heart attacks. I mean, Dr. Charles Farr, who's an MD, PhD, showed early on that you can actually reverse myocardial ischemia, heart attacks, with hydrogen peroxide injections. Now, what is hydrogen peroxide? It's a natural substance that every cell makes, everywhere. It's H2O2, it's water and oxygen held together. It's a natural thing. It's in rainwater, breast milk. It's a natural stuff. So it's how our thyroid works. It's how everything. So anyway, that injected would do it, rather than some drug that'll poison an enzyme to dilate an artery. You know what I'm saying? So I think that pharmaceuticals are based on a false belief. Well, that's a very good question about prevention and waiting until you get a diagnosis. Remember, a diagnosis, the word dia means separate. Gnosis comes from knowing. So they separate from know. In other words, they give it a name. Giving it a name. So get a biopsy of a tumor, of a mass, and I see that the cells have a certain, what they call morphology, a certain shape, and it's happening in a tube. So I'm going to call that, it's a duct. I'm going to call that ductal carcinoma in situ. So the names we give it is just a description of what's there. Adenocarcinoma. Adeno means from a gland. Carcinoma, it means proliferation of cells. Hypertension, high blood pressure. Well, you got to realize that the diagnosis is almost irrelevant. It's like calling it an apple, because it doesn't help you with the two most important things you need to know. How did I get it, and how do I get rid of it? It gives it a name. What we want to do is realize that we all are at varying degrees away from being at optimal functioning, which is health. Health is optimal functioning of the organism. Now, if you get so far from optimal functioning that you're actually having some dysfunction, it'll be noticed. You'll go to a doctor and they'll give you a diagnosis. You've got cancer, you've got high blood pressure, you've got ischemic coronary artery disease, whatever it is. That's a diagnosis. But I just want you to know that we're all on our way. We're all on the road to losing optimal functioning. Okay, so when we talk about prevention, what we're saying is, let's jump back in to living the way we were designed to live by God, by the universe, by nature. Live according to that way, and whatever conditions were occurring in our body that would result in a diagnosis won't happen.